Good afternoon. My name is Kendall Osborne, and I am a family nurse practitioner student at Auburn University. And this is my video on role acceptance and awareness of the nurse practitioner. So what to expect during this presentation, I will show a video of interviews with an unbiased individual regarding their current expectations and knowledge of the roles of the nurse practitioner. The purpose of this video is to educate the public on the role of a nurse practitioner, examine the various roles and responsibilities of a nurse practitioner in today's healthcare system, and to increase the acceptance and awareness of the nurse practitioner in the eye of the public sector. So first we'll hear from Kayla on her opinion of what a nurse practitioner is.
From my experience, I think a nurse practitioner is someone who receives training in diagnosing and treating patients and is also able to practice independent or alongside actual physicians.
So nurse practitioners must complete a graduate level program earning a minimum of a master's degree from an accredited institution and must also be a registered nurse. Nurse practitioners are licensed autonomous clinicians focusing on preventing disease and managing complex health conditions. And nurse practitioners often specialize in a specific patient population, including but not limited to pediatrics, adult, or women's health. So next, Kayla was asked what she thinks the main roles and responsibilities of a nurse practitioner are.
I do think some of the roles and responsibilities of nurse practitioners are very wide, but I think some of the main ones that I've noticed myself are them caring for the patient, but also focusing on their mental and emotional health, which is important, as well as their physical health. I know that they diagnose conditions, order tests, and assess patients, like similar as physicians do, while providing well-rounded healthcare.
So as Kayla was saying, the role of the nurse practitioner is unique compared to other medical professionals due to their emphasis on the well-being of the whole individual. A nurse practitioner has many different roles, acting as a clinician, a consultant, a leader, an educator, and a researcher. A nurse practitioner is proficient in diagnosing conditions, ordering diagnostic tests, conducting examinations, providing education, and prescribing medications. Nurse practitioners perform thorough examinations and obtain health histories and subjective data from their patients in order to make clinical decisions. And nurse practitioners collaborate with physicians and other healthcare providers to care for complex patients and diseases and provide specialist referrals if needed. Lastly, Kayla was asked if she would consider seeing a nurse practitioner as her primary care provider and why so or why not.
I would consider seeing a nurse as my primary care provider. I know that my actual primary care provider now has that as an option, and I actually have done that for an appointment before, but I definitely think that they are just as capable of diagnosing and figuring out the issue as physicians can be, and I think that it would be a great alternative to seeing a physician every time.
Nurse practitioners are qualified clinicians who are important in meeting the rising demand for primary care providers in the United States. According to the American Association of Nurse Practitioners, care provided by a nurse practitioner is safe, effective, cost-efficient, and is comparable in quality to that of physician care. And furthermore, care provided by a nurse practitioner may result in higher patient satisfaction, fewer hospital admissions, and fewer emergency room visits. So a couple of the main takeaways from this presentation: nurse practitioners are registered nurses that have received specialized and advanced education. They are clinically competent to provide medical care to a variety of diverse populations. The nurse practitioner as a clinician has developed clinical expertise that enables them to diagnose, treat, and manage complex health conditions. And the role of the nurse practitioner is fundamental in meeting the growing demand in the United States for primary care services. I hope you guys enjoyed this presentation and go see your nurse practitioner. There's some references.